Okay, good good morning everybody. Today is Wednesday. It is March 20th. We're going to continue our stroke care series. We discussed a lot within the last 2 days of what a stroke is, what to look for with the warning signs. Now we're going to talk about a few things before we actually get into the stroke care. Now, yesterday I talked about my husband had speech therapy. We're going to go over what the different therapies are in-house and what to expect when they come. But before we get into that, there is one thing that most stroke patients or stroke victims or victims that have had a stroke will develop what they call aphasia. And aphasia is a term used to describe a person that has a paralyzed face muscle. Could be on the right side, it could be on the left side. It can make speech very, very difficult. It can make a person not be able to get a thought or a idea across. In my husband's case, he cannot complete a full sentence unless he fully concentrates on doing so. And it makes him very, very frustrated, which is why speech therapy is working with him. And it's very important to speak in a nice, calming voice with a stroke person. Now, aphasia does not mean that the person is an idiot. It does not mean that they have a lot of brain damage that renders them a dummy. It just refers to the fact that a muscle in their face is paralyzed and needs fine-tuned motor skills and speech therapy. Now, my husband's speech therapist is a wonderful person. She described it this way: if you were smart before your stroke, you're going to be smart after your stroke. If you were a total idiot before your stroke, you're still going to be an idiot after your stroke. The stroke does not cure idiocy. I think I said that right. So, having a stroke is not going to make somebody even smarter than they were, and it is not going to make somebody who was smart dumb. It just means that they need to have the resources to build back the way that they were pre-stroke. Now, you can visit the aphasia website, and I believe it's aphasia.org, and there will be things that you can print out for both the caregiver as well as the person with aphasia. And it just explains, that they have trouble communicating if you talk slow to them. And the biggest thing is you need to be patient with a person that has aphasia. Patient is a very, very key thing, and it's very easy for the patient as well as the caregiver to get frustrated. But if you are nice and patient and calm, eventually you will work out a system. My husband and I have a system sort of in place where he can get some of the thoughts that he will have in his brain and relay them to me. It may not come out of his mouth. And a lot of times, if a person has problems with their speech, you will notice that they really know what they want to say in the brain, that it's fully in the brain. The pathway to the mouth just cannot get it out. And that's when you want the patient to undergo vigorous therapies. So let's get into the therapies, what they are and what they're used for. Now, yesterday I was showing you the part of the brain that my husband's stroke is. Now, this is the right side of my body. So his stroke actually was on this side of the body, the left, because the left affects the right affects the left. That's how the brain is wired, so there's no confusion. So there are 3 types of therapies that are offered for stroke patients or patients that are in the hospital that need therapies. There's occupational, speech, as well as physical. we're going to start with physical. Physical deals with the motion of the body, balance, walking, sitting, tasks like that will have physical therapy. And physical therapy is a key component for people that have had massive strokes or big enough strokes where they have weakness on one side of their body, or they've lost the ability to walk, reach, pick up stuff, things like that. Occupational or physical therapy will help with that. Now, occupational therapy deals with the fine motor skills and usually focuses more on one activity, whether it be the hand or the leg, picking up, grasping, being able to eat, doing tests such as brushing teeth, zipping up a zipper, buttoning up a pair of pants. Those are what occupational therapy will do. And there are different levels in each therapies. And before the therapists start offering their services, you will have an evaluation where each department head, from physical, occupational, and speech, those are the three types of therapies, each one will have their own evaluation or evaluator that will come to the house and address the patient's need. The third therapist will be speech, and they will deal with speech. And there are a lot of learning tools that you can use for a person that has had a stroke if they are not able to communicate. And it's very important with speech therapy to get the patient started immediately or as quickly as possible with speech therapy to retrain the brain on how to say stuff. Now, a little bit later, probably next week, I will show you some tools that the speech therapist has given my husband and tools that you can use inside the home to help communicate with a person that has had a stroke, that has aphasia, that is not able to communicate fully with you. Now, these are tools for my husband's case. Will they be helpful for you or somebody you know that has had a stroke? Yes, but always make sure to talk to their therapist before progressing with what I'm going to give you, because they may be on a different level. They may need some sort of different therapy. So always make sure to talk to their therapist before you add something new to the regimen, because the last thing you want to do is get the patient frustrated as well as yourself frustrated. So most hospitals, when they send a stroke patient home and offer home health care, will set up appointment times for the various therapists and nursing staff to come to the house. Now, my husband's case, they are supposed to call the night before and set up an appointment for the following day. Now, does that always work? No. And I will tell you from going through this ourselves with him, the biggest thing is if you have doctor's appointments, meaning that the patient needs to go see a doctor or needs to do a follow-up, keep those appointments. Those are very, very important to do. Do not cancel any doctor appointments for physical, speech, occupation, or home health care visits. They will work around those appointments. And if you have good home health care, they will understand that doctor appointments are hard to get and usually need to be made weeks in advance. So always talk to your home health care team and let them know when the patient needs to go see their doctors. And they will gladly work around your schedule versus you working around their schedule. That'll make it easy for everybody not to get upset and not to get stressed out when you're working with the home health care team. So, the home health care team will come and do the evaluation, and then they will set up and send the appropriate people to the house. Now, yesterday at about 11:30 to 12 o'clock on Tuesdays and Fridays is when my husband has his speech therapy. And she spends about an hour and a half, sometimes even longer, just going through exercises and stuff with the patient. Now, it's very important as a caregiver that you give the therapist and the patient some of the space, but don't go running to the grocery store and leave them totally alone, especially if the patient is unable to fully communicate for himself, because sometimes questions need to be answered, or the patient gets really frustrated and starts to have a brain shutdown, which just means that the brain has been overworked and overstimulated, and it kind of takes a kind of like a reboot period where the brain just doesn't want to process anything. So it's always good for the caretaker to be in the house, but not necessarily be with the therapist and the patient. Now, I live in a tri-level house, so yesterday I was in the kitchen, and as needed, I would go downstairs and work with the therapist. Now, it's very important as a caregiver, or if you are a full-time person that is living with the stroke patient in the house, that you follow along so that you are able to help as best can when the therapist is not there. That means going through exercises with the stroke person. And they don't have to be long exercises, usually 5 to 10 minutes in the morning and maybe 5 to 10 minutes in the evening is sufficient. You don't want to overstimulate the stroke person because they can get frustrated very easily, and that can cause a lot of stress on you. So always having good communication with your therapist is key role into getting the patient the best care that they deserve. I've seen too many people get fluffed off, and it doesn't do anybody any good. So those are some great tidbits that I wanted to share with you. We're going to keep going through the stroke care line and talk more about the therapies, what they exactly do, and how long you can expect a stroke person to, what the recovery time is. And let's dive into that a little bit. So you know somebody that had a stroke that maybe can't talk, maybe they can't walk, maybe they're having very difficult moments in their life once they've gotten released from the hospital. How long will it take them to be normal? Well, each person is going to be different. The average length of time for a stroke person to recover can be up to a year or longer. You heard me right, a year or longer. The more severe the stroke has been, the longer it's going to take to recover. Age also will factor into this. The older the patient is, the longer it's going to take them to recover from the stroke. Now, younger people have a tendency to bounce back a lot faster than older people. In my husband's case, they're looking at a window of 3 to 6 months for his speech to return. And this is not going to be an overnight miracle cure. He's not going to go to bed one night, wake up in the morning, and all of a sudden be able to talk. He's going to have to retrain his brain to do those exercises. I need to let them out, so I'm going to stop the video for today. Thank you guys so much for tuning in. We're going to continue this series as we progress. I'll be back, and we'll discuss post-stroke care. Okay, hi all. Welcome back to stroke care, and I do apologize for the video that you saw previous to this one. Dogs needed to go out. They were barking. One is currently outside, and that was a lot earlier. You can also tell that my nails got done today, so I took a little bit of a break. And we were talking about the therapy and what the therapists do. One key component to working with a stroke patient, and I will say this probably throughout the videos, is patience. And it's very easy for the caregiver to get mad, upset, scream and shout, and that is not good for the stroke patient. Same thing is the stroke patient can get upset very easily. They can get agitated. You might notice a change in their mood. Being patient keeps the stroke patient on a level playing field, and that's the best key component to good care for a stroke patient. Now, it's very easy at the beginning when the stroke patient returns home for you to want to baby them. And I will be the first to say I've been guilty of that. Go at the stroke patient's point of view. My husband was very quick to point out that I didn't need to hover over him as much as I've been doing. Now, does that mean that he's totally independent? No, it does not. But, you know, I can take time for myself. I can go get a manicure. I can leave him alone for periods of time and not necessarily have to fully worry about him. Now, can he call out if he needs immediate help? No, he cannot. So those are things you want to keep in the background when you're taking care of a patient that has had a stroke. The other thing for the caregiver that I'm going to point out is take some time for yourself. At the beginning, you're going to be so stressed and running around. It's very easy to get lost in caring for someone full time. And you need to take moments for yourself, whether it be have a person sit with the patient so that you can run groceries. You can take some time and get your nails done. You can go out for a cup of coffee. Now, all of you who have seen Bob and I know that we're both smokers. Bob is a former smoker. He quit smoking and he is now 1 month post-smoke. I was going to quit at the same time he did, but it's never a good idea to quit smoking if you're caring for somebody that had a stroke, because that puts even more stress on you. So what I did is I made changes. I no longer smoke in the house, where I go outside if I need that cigarette. And that's okay. Take time for yourself so that you're not so stressed out when you're working with a stroke patient. Now, you might be asking, am I going to put Bob on camera? Right now, no, I'm not, because he needs his privacy, and right now we're not ready for that. But later on, as he progresses with his stroke care, I may feature him and have him do a perspective from a stroke patient. So we're going to focus on stroke care. We talked about the 3 different types of therapy that are offered for a stroke patient. And in the next series of videos, we're going to start to look at what each one specifically does and what are some of the tools that you could utilize for a person that has come home from the hospital or a rehab center post-stroke. And one thing I will mention that I did is I went on Amazon, and the occupational therapist had mentioned to get these. Now these are called foam grip tubing grips, and there are five per package. There's the yellow one, a blue one, and a red one. And I will kind of show you the holes so you guys can kind of hopefully see this. The red one is used for utensils such as spoons, forks, knives. You just slip it on, and you're able to cut these with a pair of scissors. And this allows the stroke patient to get a better grip, especially if they have weakness or if one side of their body has been affected. Now, since my husband's right side is affected, this gives his right hand able to grip food so he can feed himself. Now, he does shift where he uses his left hand more than his right hand, but it starts to do that fine motor skill. And the blue one you can use for larger items such as markers or pens, and the yellow one is very good for like pencils and pens to get them to hold a pen and a pencil. So those are some tools. These can be purchased on Amazon. They are not that expensive. I think for the 6 of these, I think I paid $12 for them, and they can be reused time after time. America, I've got one that I've cut for them. It didn't cut quite the right way, but I slide this on a utensil, and unfortunately I don't have any utensils here, but I'll do a video on how to properly use this. Actually, since we're here, why don't we do this? So when my husband eats a meal, whether it be breakfast, lunch, or dinner, and we're gonna go over meal planning, you just take a silverware and you just slide your grip on, and now you have something that the patient is able to easily grasp. Whereas sometimes they won't be able to grasp this because this is considered very small, and they don't have the fine-tuned motor skills needed to do that. So getting these things is a big help for a stroke patient. Now, eventually he'll outgrow these. He won't need to use these anymore, and he can go back to regular eating. But these are a great tool to have for a post-stroke care person or anyone that's had a traumatic brain injury. You don't necessarily just need to use these for a stroke patient. You can also use it for somebody that has had a traumatic brain injury. And it just assists them in their day-to-day lives. So going forward, I'm going to not do any more videos this week because Bob has physical and speech therapy potentially 2 times this week, as well as an eval for the occupational therapy is going to come back. We're going to discuss some problems that may arise with a stroke person and what to do about them in the next segment of videos. So stay tuned for that. Thank you guys so much for your love and support. I've been telling Bob that you guys have been commenting and wishing him well. He is progressing nicely each day. And we're going to talk about what to look for progress-wise and the milestones that a stroke patient will go through each particular day. And they are very, very small. They're not huge milestones, but there are milestones to show that the patient is progressing nicely post-stroke. So follow me along as we continue our stroke series of care, and I'll see you on the next Stroke Care with Joel.